Okay, back in January, Dr. Stephen Lin, world-renowned dental nutritionist, visited with us, but the show for that day was preempted due to breaking news. So now, here is Dr. Lin with information on what your smile reveals about your true health. It's January, the start of a new year, and it is time to get your body back on track. But if you want to prevent serious health problems, you may be looking in some of the wrong places. Turns out your smile is a big key here. Dr. Stephen Lin, a world-renowned dental nutritionist, also a dentist, joining us now. And we're going to talk about this, the mouth, underlying signs of illness that all manifest in the mouth. Is this correct, doctor?
Absolutely. Thank you for having me. Yeah.
Sure, yeah.
I think there's been a lot of misconception about how important our teeth really are. You kind of go to the dentist to try and fix problems. You've got a broken tooth or some gum disease, but really the mouth is one of the most important signposts for diseases all throughout your body.
And in that same vein, I guess when we're looking at our mouth, even brushing, that kind of thing, I mean, let's start with the basics here. What are we looking for? What should we be alarmed by? That kind of thing.
Look, the main thing is that the mouth is the first signpost of disease right throughout the body. So bleeding gums, for instance, is a sign of inflammation. So most dental diseases are very long-term processes. Okay. So if we can spot the warning signs early, so bleeding gums, discoloration, tooth sensitivity, there are issues there that can give us warning signs of other things going on.
Would you say, for most of our Marylanders watching now, most of us have a dentist, a regular dentist, and you say, as well-intentioned as these practitioners are, in some cases they may be kind of looking at the wrong things. What do you mean by that? Talk about that.
So we've missed the core processes as to what's driving dental disease. So the way I like to say it is that if you have a car problem, do you take it to the car wash? No. You want to look under the hood, right? You want to see what's happening in the engine, right?
Of course.
So brushing and flossing, toothpaste and mouthwash, they're all very superficial ways to look at dental health. Gotcha. And so really, if we want to understand food, that's how the mouth is shaped, and that's how we understand tooth decay, gum disease, even braces in kids, so jaw growth. That is a problem with nutrition. We need to understand that the mouth is the best way to model food and eating. That's what we do in the book.
Yeah. Well, I guess it's called the dental diet for a reason, obviously, and you're saying through better nutrition, and I know you brought a few samples here, better nutrition, this is going to lead to a cleaner mouth to begin with. Brush, floss, sure, but you may not do that less if you're eating clean. Is that the correct way to look at this a little bit?
Look, the main thing to look at is tooth decay, for instance, is a nutrient deficiency. So we have an immune system inside our teeth that prevent decay. If we feed them the right nutrients, the fat-soluble vitamins, it's really important.
A natural defense, and I know one of those would probably be like your Greek yogurt has some of that healthy fat.
Yeah, exactly. Full fat foods like dairy, well-sourced dairy. But for instance, these ingredients here is just an example of how you can make a no-sugar chocolate sauce. So we've been telling patients not to eat sugar for a long time now. Yeah. But what do you do to replace it? And so we learn that in the book.
A little cinnamon, a little coconut oil, cocoa, ways to add flavor without a big sugar bomb.
Yeah, exactly. Okay. So many patients have problems with these processed foods that do damage to the teeth. We need to learn how to replace them.
It's all about, I guess, it's making those teeth healthy from the inside out, correct? It's like sugar. We know it's bad for the surface of the teeth, but if we eat a lot of it, it's bad for the system and the inside as well.
Absolutely. We've learned so much about what sugar does for systemically in terms of type 2 diabetes, obesity, even Alzheimer's and dementia are now linked to carbohydrate intolerance in the body.
Fascinating, too. You were talking about our parents out there with young children. Hey, you may be able to prevent braces even. Straighter teeth can come in on a healthier diet.
Here's something that every parent needs to know, is that crooked teeth is a sign that the jaws aren't growing properly. So it's actually a symptom of creating a facial growth issue. So if we eat the right foods, children now will actually grow jaws naturally. And there's a orthodontic model now where we can intervene in this process, get them functioning right, eating right, and the diet is the underlying factor to do this.
All right. Well, Dr. Stephen Lin with your website, drstephenlin.com. Stephen with a V, Australian accent. Doctor, thanks for coming in today. Great to have you here. We will be back with more Midday Maryland right after this. Stay tuned.